Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics.
New hope for pemphigus patients, Candela goes back to its roots, and Dupixent gets approval for adolescent patients. Ahead on DermWire TV. Welcome to DermWire TV, from the editors of DermWire.com and Practical Dermatology magazine. I'm Rana Jaraha. Phase 2 data from the BELIEVE PV study for PRN 1008 show that the investigational agent from Principia Biopharma reached the primary efficacy measurement of control of disease activity in conjunction with low-dose corticosteroids. Findings were presented at the annual meeting of the AAD earlier this month. Dr. Didi Morel is professor and head of the Department of Dermatology at the St. George Hospital Clinical School, University of New South Wales in Sydney, Australia. She was lead principal investigator for PRN 1008 and spoke to DermWire TV about the findings.
This is a BTK oral inhibitor taken twice a day. In the Phase 2 study that I presented at the late breaker session at the American Academy of Dermatology, patients with relapsing and new onset pemphigus took this PRN 1008 new medication twice daily for 3 months, and then were followed up for 3 months to see how long it took for their disease to relapse. Within 4 weeks of starting the treatment, over 50% of the patients were already in control of disease activity, with only 12 milligrams of prednisone taken concomitantly. In addition, some of the patients were already in complete control of disease activity by 2 weeks, and the majority were in complete control of disease activity by 12 weeks. On average, it took patients at least 2 months after that 3 months for their condition to relapse, with a range from about 1 month to more than 99 days. It had an excellent safety profile. We've now launched the registration trial, which is a Phase 3 trial called the Pegasus trial.
The Phase 3 trial is recruiting in the U.S., various European countries, Asian countries, Brazil, and Australia. Candela has rebranded to reflect the unification of the Syneron and Candela brands. The rebranding, complete with an updated logo, was announced in advance of the annual meeting of the AAD earlier this month. Jeffrey Krause, Chief Executive Officer of Candela, spoke to DermWire TV to discuss Candela's new brand identity.
I'm really excited to announce the rebrand of Candela. It symbolizes our company doubling down on medical aesthetics and focusing on both the plastic surgeon and dermatology market to provide the absolute best medical aesthetic energy-based devices in the market. Candela means science, results, trust. That means we are investing heavily in the science to build the best possible devices. We are investing in the clinical trials and clinical proofs to drive effective patient results, and we are providing 360-degree support for our physician community to help them to be successful with their patients getting consistent and superb clinical results.
As part of the rebrand, Candela launched a new website, candelamedical.com. Sebaceous microparticles confer benefit in the management of acne vulgaris in real-world settings, data confirm. For the EU registry study presented at the AAD annual meeting, patients were prescribed a 2 to 4 week course of topical retinoid plus benzoyl peroxide prior to treatment with sebaceous microparticles to determine what effect the combination may have on long-term acne outcomes and acne medication usage. Laser expert Dr. Jill Weibel, who presented the data at the meeting, spoke to DermWire about the results.
What we've seen in the new European data coming out is that when you use a retinoid for 3 weeks to pre-treat, there's an 85% reduction in acne 12 months later. So this is potentially a treatment that will go head-to-head with isotretinoin. It will be at least a major remission, if not a cure. We thought that if you cleared out the pores and washed really good, that the nanoparticles would go down. But early on in the research, we saw that there was very inconsistent times that we could get the nanoparticles down. That's why we brought the retinoid in, so that you could get the keratin and the sebum out of the pores. But what we really learned during the study is that the oil gland will fill up within 4 hours. So for patients that are going to get a facial or patients that are doing some therapies to take out sebum, it's a very temporary effect. The oil gland is like a volcano and it will keep going up, which is why the nanoparticle is very exciting because it permanently destroys the sebaceous gland.
Dr. Weibel says sebaceous treatment reduces the need for ongoing topical therapy and dependence on antibiotics for acne. 3 sebaceous treatments administered 1 week apart provided improvement in acne for up to 12 months. Dupixent from Regeneron Pharmaceuticals and Sanofi is now approved to treat atopic dermatitis in patients ages 12 through 17. In the phase 3 trials of Dupixent or dupilumab in adolescents, more than 10 times as many patients on active treatment achieved clear or almost clear skin compared to controls. The safety profile of Dupixent in the adolescent trial was similar to the safety profile from trials in adults with atopic dermatitis and consistent through 52 weeks. That's it for this edition of DermWire TV. You can always get news updates at DermWire.com or via your Echo device. Just visit the Amazon Skills Store and enable Dermatology News Skill. Then tell Alexa to play Dermatology News. Thank you for watching.
Thank you for listening to DermWire News. This editorially independent program is made possible with advertising from Ortho Dermatologics.